People from black and ethnic minority communities are being disproportionately affected by the coronavirus pandemic. In the last hour, the Office for National Statistics has released figures looking into deaths from COVID-19, broken down by factors including ethnicity. Black men are 4.2 times more likely to die of COVID-19, and black women are 4.3 times more likely to lose their life to COVID-19 than their white counterparts. Well, Sky's Inzamam Rashid is in the newsroom. Inzamam, people have long looked at the apparent disparity amongst deaths, but these are the hard facts.
They are these stats coming out from the Office for National Statistics this morning, Adam. We've been talking about this for about 3 to 4 weeks now, ever since we got an idea that COVID-19 was disproportionately affecting the black, Asian and minority ethnic community. And now these stats really confirming that. We've had a lot of anecdotal reports and very early reports from different organisations, but these hard stats, which include figures from the ONS and NHS England and Wales, really are confirming that issue, that BAME people are disproportionately affected as a result of COVID-19, and the death rates are showing that. Now, these stats from ONS clearly say that the biggest risk appears to be in black men and women when accounting for age, which is what they've done in this analysis. Black men are 4.2 times more likely to die with COVID-19, and black women are 4.3 times more likely to die than their white counterparts. And the risk then is reduced slightly, but only to 1.9 times once their factors are taken in, and those factors include socio-economic factors and also health conditions. Now, the interesting thing about this report from the ONS is that it's actually the first time, Adam, that we've seen figures not only from hospitals across England, but also in the community across England and Wales as well. And it's the first time we're actually witnessing the ethnicity deaths amongst those communities in those two nations. And what it also suggests is that there are some important factors that are playing a role amongst the disproportionate number of deaths, and those include socio-economic issues and deprivation amongst the BAME community, and also underlying health conditions. Now, those could include things like type 2 diabetes. It could include heart problems as well, which is obviously a huge problem when it comes down to dealing with coronavirus when you are in intensive care and in those critical units. And also the social deprivation comes down to a number of factors, including overcrowded housing and cultural factors like multi-generational housing, where it really makes it quite difficult to self-isolate and to social distance in those areas, meaning that viral load is quite high. Now, there is a bit of discrepancy within these ONS figures, and there's a segment really where they haven't accounted for a specific factor, and that potentially could be a result of occupation, Adam. We know that people from a black, Asian and minority ethnic community are working in these key worker roles throughout this pandemic, a lot of them on the front line in the NHS fighting COVID-19, a lot of them driving buses. They're more vulnerable to getting the virus. Tube drivers here in London as well, and those working in shops as well, and that potentially also has a huge role to play in the disproportionate number of deaths. I just want to give you some more insight into this report from the Office of National Statistics as well. They say that males in the Bangladeshi and Pakistani ethnic group were 1.8 times more likely to have COVID-19 related deaths, and women from those backgrounds are 1.6 times more likely to have COVID-19 related deaths to their white counterparts. And they also say that Chinese and mixed ethnic groups are also amongst that group as well. So clearly the ONS stats today confirming what we've been speaking about for the last 3 weeks, that there is clearly a disproportionate difference here in the number of BAME deaths in comparison to the general population. And what the questions will be now to the government is, what are they going to do to try and prevent further deaths like this happening throughout this pandemic, and if another one happens in the future?